Our guest during this segment of the program is Dr. Jonathan Tripp, and of course, we call it Better Health with Tripp Family Medicine. The doctor or one of his associates joins us on Wednesday mornings between 8:30 and 9 o'clock, and we have a different topic we address every week. And these are usually very topical, though, to the listening audience because they deal with certain times of year when we see a lot of these issues arise. But we're talking today about fungi. And first of all, doctor, welcome back to the show.
Good morning, and there is a fungus among us.
Yes.
So,
Well, I have been in this situation. In 1986, when I was a grad student, I went to New York on a trip, and I remember I had a long walk to a museum one day, and I was just wearing loafers, and it was raining and wet, and I developed serious foot fungus after that, and that stayed with me for a few years before I was ever actually able to get rid of it.
and that may have been because you didn't know what to do with it, or not correctly diagnosed. So a lot of people have had athlete's foot, or oh, I better be careful with the terms I use. I have some terms that were taught to me by a doc who had spent time in Vietnam with lots of fungal infections.
Especially
Uh,
of the feet, right?
yeah, feet, groin, armpits, the whole deal. So Um, they can be really, it can be really mean. But let me distinguish between what's a fungus or a fungi uh, versus bacteria and viruses, because we kind of think of all things as bacteria. We think of a cold as a virus, but the truth is a lot of our illnesses are caused by viruses that we don't have an antibiotic for, because antibiotics treat only bacteria. So, fungi are actually a separate group of microbials that can either be okay or cause us trouble. In fact, the yeast you use to raise bread, that's a fungus. So, there are beneficial uses. Mushrooms are a fungus. So, I love mushrooms and about everything we can put them in. So, to say that fungus is all bad isn't true, but when it's trying to make your body its host, that's probably not a great thing. So, we'll talk about different types. I probably would start out with what happens this time of year. We're just getting our early sun exposure, and moms will have a kiddo, especially if you have any darker skin type, but it happens in all skin types. Mom will bring the kid into the doctor and say, "What the heck? My kid's got this white spot on his cheek or on his arm or on his back. What's going on?" And the concern is there a major illness? Sometimes it's as simple as dry skin called eczema. There's also another condition that's called pityriasis albicans, which just mean or pityriasis alba, which just means a white spot that it, is defined as its shape, which is usually kind of an oval spot, often between the size of a dime or a quarter, and real concerning. But sometimes that white spot really is a low grade fungal infection. So, kind of like the athlete's foot, and often caused by a similar fungus. There's different types. There's tinea, which has several types of its own, candida. So, these are all called dermatophytes because they like to live on the skin. Dermato, or the derm part means skin, and so they like to live on the skin.
This is different than something that might burrow into your skin but look like a fungus, right?
Yeah, the things that burrow into your skin are usually parasites. I mean, I can talk about scary things like I just looked up bot flies, and there's all kinds of fun things and hookworms. But fungus is really very small, small enough you can't see it. And the probably the most common one people are familiar with is ringworm. And this will happen on any age, and we often associate it with being uh, contagious from cats, sometimes dogs, but mostly cats. But most of the time, we really don't know where it came from, because the different fungus that we have are always on our skin. But why does it take hold at a certain time? But a ringworm actually looks like a circle that the middle starts to clear and look good, but the outer ring, or what they call the advancing borders, remain kind of red and flaky, scaly, and doesn't go away usually just on its own. So, but there's some simple topical answers, over the counter athlete's foot creams like clotrimazole or Lotrimin, and Lamisil is probably another real common one. And these can be used, but the problem is people will use them for 2 or 3 days and say it doesn't work. but the skin actually needs these treatments for 2, 3, and sometimes 4 weeks before it clears up.
That's how I got rid of the foot fungus was about 6 weeks of actual treatment twice a day.
Yeah, twice a day.
And then that finally cleared it up. You could tell simply the skin just started peeling off in sheets, and the skin beneath it was nice and smooth for the first time in years.
And that's exactly what happens with a fungal infection is we're not actually killing or curing the skin on the surface. That has to exfoliate, and so that time frame for the new skin to come up is what you have to continue to treat. So this is something that often the question is, what am I dealing with? Am I doing the right treatment? And that's where your healthcare provider can really help out.
We've got more coming up with Dr. Jonathan Tripp in just a couple of minutes, talking fungal infections this morning. And of course, those can be from head to toe, so we'll have some more detail on all of that in just a few minutes, too, as well. Your telephone call is expected at 736-0300. It's Better Health with Tripp Family Medicine on News Radio 1310 KLIX and newsradio1310.com. At 20 of 9, we have 72. Our studio guest, Dr. Jonathan Tripp, Better Health with Tripp Family Medicine, Wednesday mornings between 8:30 and 9 o'clock right here on News Radio 1310, KLIX, newsradio1310.com. Bill Colley handling the soundboard and the telephone as well this morning. 72 right now at 8:50 or 8:43. And the doctor and I were having an off-air conversation that sometimes dealing with a fungus is just simply cutting off the moisture supply.
Yeah, in fact, what fungus or yeast? In fact, let me clarify that. Yeast infections are fungal infections. So we use those two terms synonymously. So we'll talk about a vaginal yeast infection. Well, that's a type of fungus called Candida. And people will have under the breast or in the armpit or in the groin an area that gets red and irritated and itches like crazy. People scratch enough that it actually bleeds, and this is the same condition, similar as to athlete's foot. In fact, quick story: when I was 12, I had athlete's foot. Had no idea really what was going on, but thinking like most people that everything's a bacteria, you just got to put alcohol on that. So, it itched like crazy. I'd wash my feet, I'd scratch them, even to the point of bleeding sometimes, and then just douse them in alcohol thinking, oh, I'm killing this darn thing. And I wasn't doing a thing other than torturing myself. So, knowing what you're dealing with helps a lot. But fungus, whether it's vaginal yeast infection, the athlete's foot, or even the underarm troubles, the the answer is you got to change the environment, and yeast or fungus like dark, moist, and warm. So if you can reverse that, not make it so moist, definitely expose it to light, and not make it so warm, it definitely blunts or stunts the growth of the fungus and often cures it. In fact, a great example I use in pediatrics all the time is a child will come in diapers, and mom complains about a diaper rash, but the rash is really in the creases or the folds of the skin more than it is just on the outer bottom. And even without medication, frequently, if I can talk the parent into taking the diaper off for 10 minutes, 2 or 3 times a day, within several days, that clears right up without medication. So that's an easy home remedy to try. But knowing the difference between fungal infection in the creases versus a true diaper rash that's just contact irritation, that does change how it works.
I had a friend I used to work with, and when her brother came home from, she told the story from service in Vietnam, he had a bad case of trench foot. And she said he would have to go to the doctor and literally have that cut off, and sometimes because it was so thick and hard. But that's a really bad case of fungus, isn't it?
It is, and the what's happening is you have inflammation under the skin, and your body's response to inflammation is wall it off or thicken the skin in the case of the foot. That's why we get calluses on the hands and the feet. It's that chronic irritation. But in this case, the irritation comes from the fungus. So yeah, that's another more severe one. Vaginal yeast infections, we often question how that happens, and probably the most common I can think of is when we use antibiotics, we change the amount of good bacteria in our body, and if you just think of that in your intestines, in your mouth, vaginally, if you kill off good bacteria, it now leaves space for something else to take hold and grow. And since antibiotics don't kill fungus, the fungus starts to grow and take over the area, and then it becomes too abundant, and now it's considered an infection.
Well, you had just said a few minutes ago that It's always present on our skin. I
It
mean,
is.
so you've just given it a foothold to grow in that situation. And so people, this goes back, I guess, to washing your hands a lot and doing these things and making sure that you shower on a regular basis, and that'll help keep these things at bay. But also dry yourself off when you get out of that shower.
Yeah, and in Idaho we have less worries about the constant humidity, constant moisture. So it's not as big of a problem, but it's still plentiful here. And I don't want to make people, fearful microphobes, that they're afraid of everything on their hands or their skin because even after washing, these are, bacteria, fungus, even viruses are present. They're diminished because we washed our hands, but they're still present. The good news is you have a nice immune system that is fighting these things all the time. So if you get little doses, even if you're putting it in your mouth, you know, you never know it because your immune system takes care of it. When it becomes a problem is when your immune system is really decreased or diminished. We often don't think about diabetes as being decreased immune system, but in fact they are more subject to skin infections of all kinds because their body is now, compromised on its immune system. Probably the most extreme that we think of is somebody that has HIV, especially AIDS level of illness. Their immune system is shot, and that's when you see thrush, fungus about every part of the body. So it'll be called a systemic infection. So that is when the immune system goes down. Now it can really take a hold.
And sometimes you'll see that, which is a lot of red on people's bodies, right? That could be a fungal infection.
Just like red patches. Yeah, and they can be red or white. There's a condition that often you see on the chest or the back called tinea versicolor. It is not harmful. In fact, it's even believed not to be contagious. So, it may look bad, but you don't catch that one. But it is treatable, and that's one we treat in our office all the time.
If you scratch it though or itch it, it makes it worse, right?
Yeah, you usually do spread it within yourself. Now, the to contrast that, the ringworm, although not extremely contagious, can be passed from one person to another. And so often, once we start treatment with a topical antifungal, really within about 2 to 3 days, they're no longer contagious.
Now, I had an old girlfriend. She was adopting a cat from a rescue, and they told her within. She took it home for 3 days, and they said you got to bring it back because we determined it had ringworm.
Oh, yeah.
So the cat went back. The cat got cured after about 10 days. The cat came back a second time, and then within a couple of years, she developed ringworm as well.
A couple
Uh,
of years?
and
Yeah.
apparently but it was still related to the cat, so somehow they were picking it up still.
Possibly. I mean, I don't know if that's true or whether that's a good assumption because how could you prove it came from that cat that was, quote, cured? But the cats do tend to carry tinea more often than others, so other animals. So maybe it was the cat's fault.
And it was on the cat's ears originally, and I think that sometimes if someone is petting an animal, that's where they're doing it, right? And that's where you would pick that up.
Sure, that'd be an easy way to do that. I don't want to crucify cats because the cat lovers out there will think I'm out to get them. But they are the most common carrier among the animals. Other places we see this. People will get a patch of missing hair on their head. They'll just have a little patch of baldness, and it gets bigger, and the hairs themselves um, are, break off or disappear altogether, and then you're trying to hide a bald spot, and the answer is you need to treat that like you would the ringworm or the athlete's foot, and that usually requires either at least over-the-counter topical and sometimes prescription medicines. You can use shampoos that are anti-dandruff shampoos like Selsun Blue. They have a weak antifungal in them. So the scalp is one. In the mouth, we have thrush. On the skin anywhere on the body, you can have ringworm or this tinea versicolor. So white spots, red spots, rings, all of that can be a place in the creases of the skin is more likely candida than the tinea type, but easily treated, and a lot of it is just simply by changing the environment. Um, I have some patients that have a chronic reoccurrence, and it's usually in the creases, and the treatment is the same, and the idea is when it shows up, you get it while it's small, and it goes away quickly.
We have a caller with us, and you're on the air with Dr. Jonathan Tripp at 8:52.
Yes, thank you. I was going to clarify something. Uh, Cats can be chronic carriers of ringworm without being symptomatic. My veterinarian told me that from his lips to my ears. So even though your friend may not have been compromised and picked it up those first few years, maybe something happened, she got into a weakened state or something like that, and then it sprung up with it. Now, cats, just to clarify, they can be chronic carriers without being symptomatic.
That sounds exactly the information that I understand.
Thank
So
you. Thank you. I want to thank her for the call. We also talked during the previous break about the fact that it comes down to sometimes the shoes you're wearing. And I had mentioned that when I was younger and on the job, I might wear cheaper shoes. My feet didn't get a chance to breathe a lot in that situation.
yeah, it goes back to this idea of they like moist and warm and dark. And so if you have shoes that don't breathe, like vinyl shoes, patent leather is another name for vinyl. You don't have shoes that breathe, you are trapping the moisture there around your feet, and it is a setup for fungus to take hold if it's present with you. And wearing somebody else's shoes that have had athlete's foot is just a great setup, worse than the cat to catch it. So if you have athlete's foot, the recommendation is, you wash your feet if you can twice a day, dry them thoroughly, wear cotton related, socks, and if you have shoes that have a mesh or at least leather that breathes better than man made materials, or better yet, go around in flip flops for a while and you'll have much greater chance of eliminating that quickly.
We have another caller with us. Caller, you're on the air with Dr. Jonathan Tripp at 854 on KLIX.
Yes, I wanted to ask if you think this might be accurate information that was passed to me. A year or so ago, I got very sick after taking some antibiotics for an orthopedic type surgery. And I actually ended up in very critical care with what I was told had C. diff. I was in the hospital for about 4 days, and they told me it was from the antibiotics, and but yet I was sent home with antibiotics. And
That's very
at one,
confusing, isn't it?
sir,
I say that's very confusing that if the antibiotics
yeah,
cause trouble and now you have more antibiotics.
yes. And the second night I was in the hospital, um, they actually come in and kept talking to me and said, "We're losing you, we're losing you." And I was so sick, I just looked up at them and said, "Bye." I mean,
Wow.
that's just how sick I really was.
Well, let,
But
let me kind of go over what actually happened there. Um,
okay,
what you C. difficile is a different bacteria that is a bad guy. We have good bacteria. In fact, we talk about probiotics, which are really just good bacteria that we either eat in the form of live culture yogurt or take by capsule supplement. But the good bacteria get killed off along with bad bacteria while you're on antibiotics. And so, if you think of your intestines as a neighborhood of real estate, you basically wiped out a fair portion of the neighbors, and now it's an opportunity for squatters to come in and set up shop and build their little shack wherever they can. But they can be other bacteria that you don't want, and that's what C. difficile is, or they can be fungus or even viral infections. So the use of antibiotics needs to be used sparingly and carefully, and that is part of my training. But the C. difficile actually requires a different antibiotic to kill it before it kills you because it causes such trouble in the colon.
We want to thank her for the call because we have to move along here, coming to the end of the program, and we haven't asked people, we haven't told people yet how they get a hold of you at the office.
Okay. Well, let me tell you where my office is because we're still taking donations for our humanitarian trip to Nicaragua, and it's my son's Eagle Scout project. So we're kind of two for one on this. And they are things like toothbrushes and toothpaste and soaps and shampoo and washcloths, even fingernail clippers, things like that. So we're asking that if you have a donation material, of the goods, bring it to our office, which is at 1411 Fillmore Street, and that's across from the entrance to the post office on Fillmore. And our phone number is 208 933-4400. And our website is tripfamilymedicine.com, and you can reach us on Facebook as well at Trip Family Medicine. So be happy to receive anything anybody wants to give, whether it's a monetary donation. We'll make sure it actually goes to the people that we're going to work with and build houses and make sure they have clean water and even sanitation. So this isn't just about handing off, toothbrushes. It really is making permanent changes in a community that really needs it.
And we should point out Dr. Tripp will have another opportunity at least once to talk about this trip, and it may happen on multiple radio stations. So
That would be great. Maybe I'll send my son, the would-be Eagle Scout.
That'll be great too. Bring him by.
That'd be great.
We want to thank him for coming in this morning, and of course, we'll be back with Trip Family Medicine next week in better health between 8:30 and 9 o'clock on Wednesday morning. Coming up though on 9 o'clock right now, and news, of course, from Fox, followed by a visit from the Twin Falls City Council right here on News Radio 1310, KLIX, and NewsRadio1310.com.